Good morning, everyone, and I hope you and your families had a great Thanksgiving. I know they were scaled down a bit, but whether you were able to be together with your family members or close friends, or you did Zoom and air hugs, it's good to be with family, and hopefully soon we'll have more and more time to spend with family and dear friends. You know, with that, we can't change the past, but we can choose how we move forward. I think it's extremely important, once again, to all the viewing and listening audience to pay heed to the advice that is given here, especially from the specialists in the medical professions, Dr. Kerouac and Dr. Roos, Helen Carlton Harris. Dr. Roos, unfortunately, will be unable to attend today. Something has come up unexpected, and I will be reading a statement update coming from Mercy Trinity Health. Dr. Kerouac is here, which I deeply appreciate, and he'll be speaking, obviously, and I know he'll have many updates and probably field a number of questions. I want to thank Patrick Leonardo, Director of Operations of AMR, for your continued efforts with Governor Baker's Stop the Spread. We appreciate that. Of course, it's always great to have the lovely young ladies, a sign language. Thank you very, very much for being here. We appreciate that. So our total cases now have moved to 6,562 since this ordeal has started with confirmed COVID cases here in the city of Springfield. The week, and Commissioner Helen Carlton Harris will go more specifically in it, this past week, 675, I believe, which is an increase of either 35 to 40. Helen will go into that. Some clusters have formed, which we're dealing with. Senior meals, the home deliveries continue, which we're very appreciative of. Due to the weather, just to let you know, AMR is not testing today, am I correct, due to the weather at the Eastfield Mall, but they will continue to test. Helen will get into our positivity rate. Massachusetts is testing about 3.7. Here in Springfield, we're about 8.4%. Unfortunately, deaths, we had 2 more deaths, and our sympathy, thoughts, prayers, and encouragement go out to the affected families. That brings the number of deaths to 138, 60 being white, which is about 43.4%, 32 being black, which is 23.1%, Hispanic is 43, which is 36.1%, Asian is 3, which is 2.1%. The deaths in long-term care facilities have increased to 80, and residential increased to 58. We had the Oasis food pantry Wednesday, pre-Thanksgiving. I want to thank John Foley, Congressman Neal, Chairman Neil Ritchie, and I were up there and serving about 3,500 families, but there was many, many more than that. I want to thank Commissioner Clapprood, Traffic Division, for being up there with the overflow, and Chris on DPW, but people were very appreciative of all the food that they were able to receive, especially before the Thanksgiving holidays. On a good note, Bright Nights opened, and they had a great crowd Wednesday before evening of Thanksgiving. Tonight, well, hopefully weather permitting, we're going to be honoring the frontline workers. Thank you at Bright Nights. And we're also going to be honoring this Wednesday military and public safety individuals Wednesday evening. This week we'll have a couple of announcements coming. One will be a major business donation going to the Food Bank of Western Massachusetts, so stay tuned on that. Also with Commissioner Helen Carlton Harris, we will be announcing the Office of Racial Equity Director this week. Helen will also speak of, as I'm sure Dr. Kerouac will be too, we're preparing for sites on the vaccine, distribution of the vaccine. So Helen and Dr. Kerouac will speak more about that. On the police front, Commissioner Clapper is down 26 COVID, 13 pending, 5 recruits in the academy also. Academy continues, but they're Zooming meetings right now. The cruiser went very, very well at Walmart this past Saturday. Thank you, Commissioner, and to the C3 Policing Unit, and to Attorney Neil Phillips and his group, who are fantastic for kids who are in need. State police are on call. Commissioner Clapp, we've set that up if needed. And we had a tough weekend. Commissioner Clapwood will get into that, but there's warrants out for arrests. You're going to see that some of these individuals, if not all, are non-cooperative. You're going to see that once those warrants and arrests are made, that these are repeat violent criminal offenders that our courts continue to let out. You're going to see in a major raid on Malden Street, 3 guns, individual, frequent flyer, on federal probation, still doing the wrong thing. Still doing the wrong thing. So again, I ask our court system to step forward, because these are all repeat names you're going to see. And I don't want to see anybody, no matter what creed, color, or background, get hurt or get killed here in the city of Springfield. So police are doing their job, and we need the courts to do their job. Commissioner Calvi is down 8 with COVID. He has 6 awaiting results, and he also has 3 dispatchers that are down. And I don't know the rhyme or reason of people. Use your head. Stay away from the Water Shops Pond. Stay away from Lake Massasoit. What is wrong with you people? You tied up my firefighters for 4 hours. Thank God they saved that individual. I understand as he was chest deep in the mud there. What possesses you to walk in the middle of a waterway area? So please, for your own good, people, don't do it. And don't tie up my firefighters for 4 hours. Ridiculous. Superintendent Warwick indicates to me that we're well over the $4.5 million, 4.5 million meals served, and they put out pre-Thanksgiving nearly 89,000 meals, so students and families had their meals for the weekend. Working with Pat Sullivan and Helen Carlton Harris, the school retrofits, ventilation continue to prepare us when and if we're able to get back our students and faculty and staff back into our schools. Town hall meeting, Focus Springfield, finally they're in transition, a new area and equipment. I believe there'll be a town hall meeting. Superintendent Warwick indicates to me December 15th at 6 p.m., as we did before, to explain to the public and the students and the families how we're going to move forward and give them an update in the interaction. Winter sports has been delayed till January. Superintendent Warwick will speak to you on that. DPW Director Chris Signoli indicates to me that he is down 3 with COVID-19. Leaf pickup is behind. We appreciate your patience. I'm included also at my house. So about a week behind, and they're working on Thursday, Friday, today on it. We appreciate your patience, and your leaves will get picked up. A perfect storm here with the combination of COVID-19 and many more people doing their leaf cleanup and also the warm weather. We still are in need of snowplow drivers. The number is picked up, but we still need that. Director Signoli will also update you that they extended the construction season to next Friday. We're supposed to close this Friday, but the weather has stayed warm. On the finances, my CAFO, TJ Plan, indicates to me for FY21 we are down about $2 million. Since this COVID-19 ordeal has started, we're down about $6.9 million. Expenses total about $15.7 million that we've spent. That's a combination of deficit spending and grants. Again, we're going to do as we've done with other natural and man-made disasters, make sure that we're able to provide for our residents and our business community. And to date, $7.6 million in deficit spending has occurred. On facilities and parks, Director Sullivan indicates to me he is down 4 with COVID-19. He continues to stockpile COVID-19 supplies and PPEs, working with police and fire and Director Signoli and Helen Colton-Harris. His team continues to retrofit all our buildings. They're currently doing electrical upgrades pertaining to the COVID-19 regulations. Sea Arena continues to be closed. Director Sullivan and Commissioner Helen Colton-Harris will reevaluate December 7th, and we'll see where we stand with those numbers. On Echo Dev, Director Sheen is unable to be with us today. Deputy Director Brian Connors is here, and he will give an update. He brought up a good point. Small Business Saturday was Saturday. I happened to be at 16 Acres Gardens to give them some business, but we're going to look to see, and Brian will get into that, to try to expand it to the whole month. Our small businesses are hurting, and they need help. Brian will speak about the quarterly report to the HUD on CARES Acting Fund. As we said before about the technical workforce training that we're putting together for our businesses, dealing with the accounting firms to prepare them for PPPs to help those small nonprofits and churches. We're also doing technical assistance. An RFP will be going out. We're getting ready, being prepared. We're very hopeful another stimulus plan will come across. I've spoken to Congressman Neal, and I know with incoming President-elect Biden that we're hopeful that a stimulus program will come forth. And as I stated a couple of weeks ago, we continue to work with Commissioner Helen Colton-Harris and Echo Dev as we're going to move forward on health-based centers for black and brown neighborhoods that have been disproportionately impacted by this virus. Brian will get more into that. On the legal, HR, and labor update, Attorney Labor Director and HR Director Bill Mahoney indicates to me on unemployment, Massachusetts is at 6.9%. The United States is at 6.9%. Though our number is high in Springfield, it is down. We're at 11.9% compared to 16.4% on the last reporting period. And Solicitor Pakula also reporting now that Focus Springfield is getting their location and equipment intact. That I'm looking to do is either our 3rd or 4th town hall meeting pertaining to police and community relations with Commissioner Clapprood, myself, Judge Roderick Ireland, so we're looking to get a date on that as soon as possible moving forward. With that, before I bring up Dr. Kerouac, and again, Dr. Roos from Mercy Hospital, Trinity Healthcare, sends his regrets for being unable to be here. After I read his statement, I'll bring up Dr. Kerouac, and then after that, so Dr. Kerouac can get back to his important duties at Bay State, we'll take questions immediately and comments for Dr. Kerouac. Then we'll go into the rest of my cabinet head's report. From us at Mercy Medical Center, we hope that everyone enjoyed a safe and healthy Thanksgiving. Even in a year marred by this unforeseen and tragic COVID pandemic, there remains so much to be thankful for, including the dedication and courage of our local healthcare professionals and the countless frontline workers who have kept our businesses and operations open. And to all of you who continue to follow advice and keep yourself and others safe. Now, he wrote this, I didn't. We also owe a significant debt of gratitude to Mayor Sarno and his team, including Commissioner Helen Colton-Harris, for their continued leadership and focus on an appropriate public health informed yet balanced response for our community. As a country, we are in the midst of a very perilous phase of this pandemic. We need to pull together perhaps more than ever before. There were over 4 million new infections in the month of November alone, writes Dr. Roos. The number of hospitalizations continues to rise. There is widespread concern that travel and gatherings over the Thanksgiving week could see another rise in cases in communities across the country. Dr. Roos writes, at Mercy Medical Center, fortunately, this past week was very similar to the week prior in terms of hospitalization cases. As of this morning, we have 18 patients hospitalized with COVID, with 4 in intensive care unit. But the severity of the illness shows that we are still seeing very sick people with this virus. We are also seeing more and more patients coming to our emergency department and outpatient areas for testing with symptoms. And clusters, as I mentioned earlier, Commissioner Carlton-Harris, of infections in long-term care facilities, both of which contributed to a major jump in our testing positivity rate to 12% this week. Dr. Roos writes, bolded, this represents 300 positive tests in just 1 week for the first time since April. So while we're eager and ready, as many of you are, for the distribution of the safe and effective vaccines, we are clearly still have high levels of concern about the rate of transmission. We will always continue to make priority your safety and the well-being of our community. Please remain vigilant, doing your part. Follow the life-saving precautions of masking, physical distancing, and staying safe to protect yourself, your loved ones, and all of us. And this is thank you from Dr. Robert Roos, the Chief Medical Officer of Mercy Medical Center, Trinity Healthcare. And with that, I will bring up Dr. Mark Kerouac, the President and CEO of Bay State Health Systems. Thank you.
Good morning, everybody, and I hope you all had a happy Thanksgiving. Mr. Mayor, thank you as always for this opportunity. Thank you for your leadership during the crisis and for the cooperation of your whole team. As Dr. Roos indicated, COVID-19 continues to spread rapidly at rates not seen before during the pandemic. We're now at 62 million cases across the world, 1.45 million deaths. The United States has surpassed 13 million cases with over 150,000 new cases per day. There are currently 266,000 deaths with over 2,000 deaths per day. We're nearing the April record of 2,700 deaths per day. So this is not just about a mild illness anymore, as if it ever were. Many hospitals in the Midwest and Plain states are at or over capacity. Many U.S. cities and other countries are moving backward on their reopening guidance. Massachusetts now has over 217,000 cases and over 3,000 per day on a few of the days in the last 10 days. Most of these now are occurring in younger people, fewer and fewer in older individuals who are outside of chronic care facilities, suggesting that older individuals seem to be following the guidelines more effectively. We've had 10,700 deaths in the state, and over 1,000 people today are in the hospital in Massachusetts with COVID-19. That recalibrated color map that we've talked about before now shows 81 towns across the state in the red zone. 9 of those are in western Massachusetts. They include Springfield, Chicopee, Holyoke, West Springfield, Ludlow, Hamden, and Southwick, as they did last week, and we've added East Longmeadow and Munson to the list. There are over a dozen other towns and cities that are in the yellow range. Obviously, more virus in the community means more virus at Bay State Health. We did not have a good week last week at Bay State Health. We passed over 100 inpatients last weekend. Today, we have 103 cases. 93 are at our Springfield campus and 10 in our other community hospitals. Only 7 are in our intensive care unit. There is unfortunately likely another spike on top of this spike. It's on the way. People who have been exposed over Thanksgiving are most likely to develop symptoms in this first week back. The people that they expose will likely develop symptoms around mid-December. If you've traveled out of state, in any state except for Hawaii, you ought to be quarantining for 14 days and considering testing if you get symptomatic. These are guidelines from the governor, and I would urge you to respect them. At Bay State, we continue to test about 1,000 a day and have no issues with personal protective equipment. We are anxious to increase our capacity, and I'm hopeful to have some good news about that next week. As far as surge capacity goes, we can open to 236 beds with our current graded surge approach and another 150 in the community. So we have plenty of headroom as far as beds go. Staffing is strained in some instances, but we are managing. There are fewer deaths and fewer people in the ICU, reflecting the fact that it's a younger patient population and that we have now more effective treatments. We've begun to monitor some milder cases in the home setting through Bay State Home Health, which has taken some of the pressure off the inpatient area, but there is still a crunch on beds. Our staff are fatigued and they're stressed, and they know that there's still a long way to go. They not only gave up their holidays to be on the job and provide expert professional care, but they also provided emotional support because these patients can't have visitors either. All of this, of course, adds to the strain. We're doing our very best to support them, and I really thank them for their dedication and their compassion. As Dr. Roos indicated, vaccines will likely gain approval this month. I expect the Pfizer vaccine to get through the FDA on an emergency use authorization around December the 10th, and the Moderna vaccine to do the same around December the 17th. The Astrazeneca vaccine may take a little bit longer since there seems to have been a glitch in their study design and their dosing protocols, but it does appear to be effective, and in the long run may be more widespread in its distribution since it does not require any special freezing and is relatively inexpensive. I also expect the Johnson & Johnson vaccine to make progress, so it wouldn't surprise me at all to have 4 useful vaccines in development in the month of January. We are awaiting a definitive distribution plan from the state. We've seen a draft plan. We're prepared to be the distribution site for Western Massachusetts. It's very likely that healthcare workers on the front lines will be vaccinated first, followed by high-risk individuals such as elderly folks in congregate living situations, people at risk due to chronic diseases, and first responders. There was a problem across the country, across the world, with what's called vaccine hesitancy, even before this pandemic hit us. It's related to some now retracted studies about side effects that have unfortunately been amplified by sources of disinformation on the internet. There's a very powerful anti-vax movement, even in our area. We've had providers here in the Pioneer Valley threatened for speaking out in favor of vaccination. Fortunately, in Hampden County, we have relatively low rates of this misinformed point of view, and most children who need them get their vaccines at a rate over 98% going into kindergarten. In a sense, the vaccines that we routinely give our kids are victims of their own success. Very few people recall the toll of the diseases that they now highly effectively prevent. You have to be almost as old as me to remember cases of fatal measles which I saw during some of my time working in Africa. On top of these anti-vaccine sentiments, though, there's an additional skepticism about this, the COVID vaccine. Many feel it's related to the distrust of treatments being pushed by the administration, which has at times been at odds with scientists. Think of the hydroxychloroquine controversy. Vaccines, however, it's important to remember, must go before an independent scientific review panel prior to FDA approval. And I want to assure you that Bay State Health will not distribute vaccine until we review those findings independently. There is enough prepaid vaccine to give out to 15 to 20 million individuals this month, and we hope that it'll accelerate in the months to come as well. Most estimates I've seen have everybody who wants one to receive a vaccine by the end of the spring. But there are some long months to go before then. Important to remember, please reduce the spread. If indeed you've traveled out of state, by quarantining yourself, perhaps testing if you've traveled. I'd also note that other cities and states are backing up on reopening rules, particularly targeting indoor activities like restaurants, bars, and gyms. It wouldn't surprise me to see Massachusetts to do that as well if we continue on our current trajectory. I also note that some cities have started to crack down on private gatherings. Believe it or not, neighbors calling the police on their own neighbors. I personally am hopeful we can avoid that in our community by everyone exercising good judgment to not put at risk your friends and your family. I also continue to hope we can open schools soon. Despite rising cases, many school districts have been able to open successfully using protocols of the sort that Superintendent Warwick has put forward. The effects of completely remote schooling on learning and mental health for children are real and must be weighed against the manageable risk of reopening. Until vaccines are available broadly, please remember what the head of the CDC himself said, that a mask, along with other precautions like distancing and hand washing, is as effective as a vaccine. Mr. Mayor, I thank you, as always, for giving me this opportunity, and I'd be happy to answer any questions.
Thank you, Dr. Kerouac. Any questions or comments from the media? Audrey Russo,
Audrey.
Western Mass News, please.
I wanted to ask you, you mentioned vaccine. There's been a couple of proposals that the federal government should pay people to get the vaccine. And I was wondering if you, in your experience with infectious disease, have ever seen this to be an effective strategy for vaccinating the public as a whole?
I think offering, the question is, there have been some proposals to pay people to get vaccine, and would this be effective? Certainly for other kinds of medical treatments, financial incentives have increased the uptake of these sorts of treatments. So it may well be effective. I'm not sure that it necessarily would be more effective than the actual inducement for being safe from the infection itself. Yeah.
You mentioned the possibility that Massachusetts is holding this site back. Do you have any inside information other than your own available to do so? Are you basing that on actual information or just a perception of the way things are going?
The question is if I had any inside information about changes in reopening guidelines. The answer to that is no. I've not heard of any particular decisions in that regard, but as I say, given the trajectory we're going on, it would not surprise me if we followed other areas, either countries or urban areas, in pulling back.
And Dr., earlier in the year when there was a lot of talk of things going on with the social justice protests, and where you said that Bay State was doing its own assessment of how it's reaching out and providing care equitably. I was wondering if you had any update on how that's been going, including what are you seeing as the people who are being hospitalized, and are these people that are reflective of higher risk populations, or you're the service you're providing overall in this pandemic?
It's certainly known across the country that there is a higher attack rate among many minority groups, people of communities of color, partly because of a higher burden of chronic disease and partly because many of them work in jobs for which there's no paid time off or for which you can't work at home. There's also a death rate that's roughly twice that, again, because of the chronic conditions. There's nothing really genetic about that death rate. It's all, you can factor it out if you correct for the existence of these chronic conditions. We have seen the same disproportionate amount of disease burden as well as disease seriousness. Because of that, our accountable care organization that cares for about 40,000 of the poorest citizens of Springfield has been reaching out and providing supplies and equipment, including room dividers, air mattresses, disinfectant masks, et cetera, as well as education to help people protect themselves. In addition to which, we've been checking in on individuals we know to have these chronic diseases. We believe that's having an impact in keeping people safe, but we are in fact seeing what others in the rest of the country are seeing.
All or 22, all total?
Does the reopening advisory group still meet periodically?
The reopening advisory group has not, reopening advisory board has not met in several months.
But
We are periodically informed of decisions to be made, but we're not meeting and advising. We had helped to devise the original schema of the staged approach as well as the measures to be used between the approaches, but there have been many specialized subgroups since then. For example, the group around higher education that have been crafting more specific guidelines. And I continue to be involved on weekly calls with Secretary Sutters, and Nancy Schindel-Fallick, the president of Bay State Medical Center, is involved with multiple calls during the week with the governor and his task force.
Were there any specific metrics that have been identified that would trigger a step back in the phase reopening?
Well, the metrics that we look at, that we pay very close attention to, are the ones that are given in the daily scoreboard, and they look at the overall hospitalization rates, test positivity rates, overall active case burden. These are all heading in an alarming direction.
About the...
I'll get to you in a minute, Audrey.
My last one. You said you were at 103 cases currently in Bay State. What was the last time you were above that figure? Do you know roughly?
It would have been probably late April. It's been a long time. We had gotten as low as 8 in early September, then peaked up to about 30 to 40 toward the beginning of November, end of October, and so it's really moved up quickly since then. Yep. Audrey, you had another?
Have you gotten into those weekly phone calls with Secretary Sutters? Have you gotten a sense as to when you might know more about vaccine distribution plans? They know working from on the daily basis back in, I think, October, September. Obviously, it's been a little while since that happened. Do you know when you might know more about their updated plan?
I'm expecting it's going to be coming soon, within a week to 10 days, in terms of really having a sense of which vaccines going to which places, who's going to be distributed, what exactly the rules are. The state has a reasonably detailed preliminary plan that had been approved by the federal government, and so I suspect they'll simply be tweaking that and getting final approval on that. I would imagine that certainly it would be released around the time of the emergency use authorization on the 10th.
Because I remember in that plan it said 20,000 to 60,000 doses, which, while it's detailed, it's kind of a large range. With the fact that now some of these are 2-dose vaccines, do you think that is still working within that frame?
Yes, the only 2 contenders right now are 2-dose vaccines, and the figures I've seen have been about 40,000, which would get you about 20,000 individuals immunized. And that would be available to be done, I'm told, in the month of December, but of course they're cranking away and making more as we speak.
22, and the rest of us are all set. Any other questions or comments for Dr. Carroll? Okay, hearing none, Dr. Carroll, thank you
Mr.
very
Mayor.
much.
I'll
Stay
see you
safe.
tonight.
Thank you. Your team's all your efforts. Okay, I'm going to bring up my Dr. Anthony Fauci Commissioner of Health and Human Services, Helen Carlton Harris, and she will give you an update on the stats and some other pertinent and important updates. Helen Carlton Harris.
Mayor, thank you very much, and thank you all, as always, for your support. Good morning. Most of the information that I'm going to give, some of the data has been given by Dr. Kerouac, so I will not repeat it. In Hampden County, there are 15,775 positive cases. The deaths in Hampden County are 907. The city of Springfield, as the mayor said, has 138 deaths, and our total cases are 6,562. The average age of hospitalizations in the Commonwealth right now is 65. If you recall, when I stood here a week ago, I said it was 66, which means that the average age is going down as far as hospitalizations are concerned. The average age of death in the Commonwealth is 81 years old, and Springfield has a very high positivity rate at 8.14%. The state positivity rate is 3.57%. Going to our dashboard, you can see the week of November 8th, there were 697 cases. We reduced the cases that following week by 65 to 632, and we have added 43 cases. Last week, we are at 675. The daily average, and I am on board number 1, and I'm looking at Sunday through Saturday's numbers. And you can see that on Wednesday, November the 25th, there were 165 cases, the highest we have ever had in the history of keeping data since COVID began. My hope around that 165 is that it reflected individuals who went to get tested before traveling for Thanksgiving or before going to visit relatives for Thanksgiving. So when I look at that 165, I'm hopeful that, that there were infections that were prevented because individuals got their positive tests and acted accordingly. But that was a high day, the highest day that we have experienced. Looking at board number 1 again, the 3-week average, you can see what we had each week as far as our numbers are concerned, and then the COVID cases by age group. The age group that appears to have the highest number, again, is the 21 to 30, which is 127 cases, 11 through 20, 98 cases, and 0 to 10, 72 cases, and we're just talking about this past week. Looking at the donut or the round case numbers, as you can see, 73% are under the age of 50. Last week, that was 79%. So what does that mean? We have added 6% of our cases in the 51 and older age group. Why is that important? Again, those are the individuals that will probably wind up hospitalized. If you think about the fact that 65 is the average age, there we've added 6% in the higher age group, which in my estimation, and I think anyone else's, that is not good. If you think about the fact that people who listened to me 1 week ago today are potentially hospitalized right now. And so people who are listening to me right now, and I'm asking you to do the intervention and prevention strategies that we've asked you to do, you're listening to my voice right now, ask you to mitigate you could potentially wind up in the hospital. Young people, if you are not doing the prevention measures, you could infect an older individual in your life and they could wind up hospitalized. I'm very concerned when I see the shift to the older age group because that means that there could potentially be hospitalizations, and even worse, people will die. Want to look at the confirmed cases by zip code, and again, the zip codes just represent the numbers of cases that we have in particular areas in the city of Springfield. They are based in population, and the population percentages you can see over on its board number 2. That pie chart represents the percentage of cases. I'm not going to go over all of the cases, but what I'd like to do right now is have you look at the map that is on the floor. Why is that important? So when we talk about the number of cases in the zip code, we're talking broadly. But if you look at the map, you can see the clusters. This is 1 week. Where you see the red dots clustered together, that means that those cases are in close proximity to each other. And then you'll look in that same zip code and see areas where you're not seeing red dots, and so that would mean that those are isolated cases. But we are following clusters. We have a cluster that we're following in organization and an organization in long-term care facilities. And so we're doing the best we can to make sure that we are in touch with individuals and doing that necessary contact tracing. We are working with our long-term care facilities as well as organizations who reach out to us. We do have information, pamphlets, flyers. If you need information to pass out, please call the Department of Health and Human Services so that we can get you the information that you need, again, to make good decisions and to post in your organization or agency. Please come and get the necessary information. We also have the limited ability to give out face coverings, and so again, we would appreciate it if you need anything that will help us mitigate this virus. Please reach out to us. We are there, and we want to make sure that we're providing all of the support we can to our residents. The cases by race, 30% is unknown. Again, unknown is a category when there is no race put down and we cannot determine what that race is because it simply says unknown. That's 30% of the cases that we saw last week. 13% were Black or African American, 22% Latinx, 32% white. That, and we had 2% Asian and 1% American, Indian, Alaskan, Native. Travel orders. The entire United States, except Hawaii, are under travel orders for the Commonwealth of Massachusetts. So if you travel from any place and you're coming to Massachusetts, there is a 14-day quarantine or a negative test that is required. There is also a form that needs to be filled out so that we can make sure that you are complying with the travel orders. The curfew still exists under the governor's order. The agencies, organizations, restaurants, casinos, everyone must be closed by 9:30 in order for individuals to be indoors by 10. Stop the Spread continues, and we want to again thank AMR. They have tested 53,806 individuals. 24,126 of them are Springfield residents, and generally there have been 3,999 positives. We want to make sure that we are very much appreciative. Putnam is still being staffed by Transformative Care or Fallon. All of this is on our website. Please go to the city's website to find the times and hours. Right now, AMR, as the mayor said, is closed today because of the weather. The vaccine. So there is local board of health telephone calls about vaccine distribution. We don't anticipate, and that will be for general population. We do not anticipate that we will be doing that until sometime in April. But we will need to set up emergency dispensing sites. These are not new to local boards of health. We have drilled through our COOP plans, continuity of operation plans in the past in order to set up mass vaccination systems. And so we've been trained in that, and that's what will happen, working with our community partners and health centers to do vaccine distribution. What's going to be important for vaccine distribution is that individuals take the vaccine, that it gets into the arms of individuals. And as you've heard, there are individuals, organizations, and others who are trusted voices in the community. We are going to need you to help us make sure individuals are comfortable getting this vaccine. We know that there is, in some instances, distrust of vaccines, distrust of the medical community, based often on a previous experience. During the call that I had with some of the individuals from the Black community who were talking about the vaccine, one of the things that was brought up, obviously, is the Tuskegee experiment and how that happened and how it really was something that people just remember to this day. HIV/AIDS was also something that individuals were concerned about as far as it being perhaps manufactured and set out to destroy populations. So there's a lot of mistrust out there. So what I need is trusted community voices to work with us to help individuals know that these vaccines have been through clinical trials. They have been deemed safe if the emergency use authorization goes through, which I expect it will. So we know that there have been past challenges around vaccine trust, and we're asking that we work together to make sure we are immunizing our population. This virus is deadly, and it's killing individuals, as we know, across the nation. And the only way we're going to mitigate is to be able to have an effective vaccine and do the non-pharmaceutical interventions we're asking you to do right now. Cover your face, wash your hands, socially distance, stay home if you're sick, and take care of each other. Despite our best efforts, we are still witnessing preventable deaths. I believe that if we adhere to the guidance, we would save lives, and individuals in our city are dying from this virus, and we need your help. I want to thank the first line providers, our healthcare workers. I cannot even imagine what they are going through right now and have been going through for 9 months. People are exhausted, they're tired, they're taking care of sick people. Individuals can't go in hospitals to visit their relatives, and yet we have people who are not complying with our requests. Businesses, we are still out there trying to work with you to make sure that you are following our guidance and asking that individuals wear face coverings when they come into your businesses. This is a difficult time for all of us, and unless we coalesce, work together, we're going to continue to see this surge that we're experiencing. Dr. Fauci talked about it as a surge within a surge. Probably in the next couple of weeks, we're going to see what's unthinkable. We're going to see that 165 number perhaps become a number that we see every single day, because we expect that because of the Thanksgiving holiday that there may be an increase. Also, I'd like you to think about Christmas. I'd like you to think about New Year's and making a plan right now about what you are going to do to keep yourself safe and your family safe. We've gotten through Thanksgiving. We don't know what that outcome is going to be as far as positive cases are concerned, but we are going to have Christmas. People are out and about. We want to make sure that we get through this together. Again, remember, people who are listening to me right now could potentially be in the hospital 1 week from today, and that could include me, and that could include you. And so please do what we're asking and stay safe. Thank you.
Thank you, Commissioner. Thank you, Commissioner Colton-Harris. We'll now go into the public safety component of this update and bring up now the Fire Commissioner of the City of Springfield, Bernard B.J. Calvin.
Thank you, Mayor. Good morning, everybody. As the Mayor stated, we have 8 confirmed COVID cases at the fire station. They're all doing well at this time. No one's in the hospital. We're expecting some of them to start filtering back to work this week. We also have 6 people who are out awaiting COVID testing. They either have sick family members or have some symptoms themselves, or have been exposed to somebody who had symptoms and they're out for testing at this point. Next thing I want to bring up is the safety around Lake Massasoit, Watershops Pond area. Everyone, please do not go out there walking in the mud. It took 4.5 hours to rescue the person yesterday. He was trapped in the mud up to about chest level. It took 75 man-hours to free him from the mud, which was a very long and trying period. We had 30 sheets of plywood out there. We had 6 ground ladders spread out over the mud, which took time then to get back out of the mud and dig out of 3 feet of mud. We had 2 ladder trucks, 2 engine companies, the heavy rescue squad, 2 district chiefs, and I was down there myself yesterday. And it was a long morning and beginning of the afternoon to get this done. It's a huge safety problem. Fortunately, somebody saw this person stuck in the mud and called for help. If this had happened in the evening when the visibility wasn't good, it would have taken us longer to get to him, and we probably wouldn't have had as good an outcome as we did have. Like I said, fortunately, he was seen and was able to be extricated from the situation, but this is a dangerous situation out there. The more you move around in the mud, the more you're going to sink, and hopefully this is a learning lesson for everybody to be careful out there. That's all I've got for today. Thank you very much.
Thank you, Commissioner. Thanks, Commissioner. And unlike the book, don't be a curious George and use your head. In Italian we say gabados, don't be a hard head. You could have been a loss of life there, and you're endangering yourself, and you're endangering my firefighters. So just don't do it, okay? Absolutely ridiculous. We'll now bring up the Police Commissioner of the City of Springfield, Cheryl Clapper.
Thank you, Mayor. Good morning. As the Mayor mentioned, I have 26, who have tested positive. 26 are out positive. 13 are pending. That means that they've been tested and we're awaiting results. 5 in my police academy are home. They're not at 50 East Street. A couple are positive tests, and some are staying with or living with others who have tested positive. At this point in time, we're able to Zoom the courses to those recruits who are home, so the academy is still continuing without missing a beat. We're trying to really stress safety when the recruits go home, to limit their exposure so that the academy can continue on. We need them out as soon as possible, so we're trying to keep going with everything except hands-on. There are portions of the police academy that require hands-on, the firearms training, the defensive tactics, etc. So the academy staff has done a wonderful job in scheduling those classes we can have early on so that they can be zoomed in, and so far we're not missing a beat. As the mayor mentioned also, it was a violent weekend over the city of Springfield, which is not unusual across the country. Firearms incidents are going up nationwide, and especially in large cities. Springfield is not immune to it. On Friday night on Keith Street, we had a murder, and we had another person shot. The second person shot is not really cooperating with us. None of the names involved in this incident are new to us, as the mayor mentioned also. These are repeat violent offenders that we continue to deal with, that are continuing to cause our communities and our police officers to be put in harm's way. Friday night at 9:50 p.m., Narcotics Unit and the Emergency Services Unit served a warrant on Malden Street. There they recovered 3 firearms that were probably more than likely going to be used in a disturbance or a violent crime. Arrested is Joshua Heathman. For an example, Mr. Heathman is on federal probation, was arrested with firearms in June, and was actually shot himself last week. That's what we're dealing with here. Saturday at 10:15 a.m. on Warrington Street, 2 gunshot victims. Both are expected to survive. That was not a gang or drug. That was more of a relationship, domestic type of an incident. So there is a warrant today out for that assailant. His name is not unfamiliar to us. Sunday at 9:40 a.m., ShotSpotter on Fort Pleasant Avenue, victim with non-life-threatening injuries, ended up turning up at a hospital. He was expected to survive. His cooperation is limited. Again, these are gun and drug incidents. The Detective Bureau is reviewing some video footage we may have of that incident. Monday, 12:30 a.m., so this morning, a female was shot in a car while on Page Boulevard. She suffered non-life-threatening injuries. The individual she was with has a long history of firearms charges, including open cases involving firearms charges, including cases that I have reported here over the past several weeks. He was in the vehicle. He was probably the target of that firearms incident. So again, it's the revolving door. It's police officers putting their lives on the line. They're doing the job. They're making the arrests. They're investigating the cases. I would join with the mayor in asking the courts to please do your job. COVID is not only a threat to those in jail, it's a threat to everyone. So let's weigh everybody's rights evenly and put people in jail and hold people accountable for their crimes. And yes, we had a Stuff the Cruiser at Walmart was the highlight of my weekend, where we were able to collect some toys for kids, disadvantaged kids in the C3 Forest Park area. Thank you, Mayor.
Thank you, Commissioner. Same old song, same old dance. And you'll see when the arrests are made again to the court system. What does it take to keep these repeat violent offenders on the streets? Just 1 or 2%. We'll deal differently with preventative initiatives that we'll do through with police department and through Commissioner Helen Colton Harris. But what does it take? And what does it take to cooperate and talk? I went by Keith Street Saturday night. Multitude of people there. Shrines, little fire going on. Nobody wants to talk. That could be you, God forbid, or a friend or a loved one that could next be harmed or killed. So to sit there and memorialize and, in essence, condone what occurred is unacceptable. We will continue to work to show a better path and way for each and every one of the individuals in question. But for those who continue to want to perpetuate violence, you're going to be dealt with differently, from our federal gang task force on down to our Springfield Police Department. very aggravating. I don't want to see anybody hurt or killed. But please, when we bring them in, you need to keep these individuals held so they don't hurt anybody else or kill anybody else. With that, we'll go to DPW Director Chris Signoli, and he will give you his updates. Thank you.
Mayor, thank you. The DPW currently has 3 employees out. They have not tested positive. They are dealing with family members who have tested positive. Today, we are working on Thursday and Friday's yard waste from a week ago, so we are at least a week behind. The volume out there is unprecedented, and by losing Thursday last week due to Thanksgiving, that also kind of pushed us back a little bit. We are right now at about 110 plows for our winter season. We need to be at 150, so we are still looking for entities and companies to sign up for plowing. The DPW has a number of positions open, mechanics, drivers, etc. Please visit the city's website for those openings and sign up for them, please. And the city's winter moratorium on construction was due to end this weekend, this Friday. Based upon the weather, we are extending it to next week, December 11th. And that's the update from the DPW. Thank you, Mayor.
Thank you, Chris. So once again, to our residents, thank you for your patience on the leaf collection. They will get picked up, but thank you again on that. Schools updates, Superintendent Dan Warwick is here, and he and his team continue to educate our students, and we also prepare at the appropriate time to get our kids back into school when it's public health-wise safe. Superintendent of Springfield Public Schools, Dan Warwick.
Thank you, Mayor. Morning, everyone. We have an update on our meals program. Since schools closed down in March, we've delivered 4,527,234 meals to families. 88,929 this weekend. We delivered Wednesday with a pack out that carried families through today, actually. So that went really well, and that's been a great program for the city of Springfield. We're going to have a town hall meeting about possible school reopening modes. December 15th, the mayor talked to you about that. We're going to discuss how we're going to return to school and get input from the public. And last town hall meeting, I believe we had 7,000 people participate, and we worked it in 6 languages. And Focus Springfield has been a great partner and is going to assist us with that again, so we can get real significant community input on how we move forward. Continue to work with the facilities department. Patrick Sullivan's been outstanding on working on doing a complete analysis of all of our buildings and then making sure all of our ventilation systems are meeting or exceeding ASHRAE standards so that when we move our kids back in, we'll be able to do it safely. Just a reminder for families that flu shots are going to be mandatory starting in January, so the family should be taking care of flu shots. And we have information on our website on that. This week at our school committee meeting Thursday night, we'll be talking about winter sports. So far, it looks as if winter sports are going to be delayed till January. So the winter season usually starts right after Thanksgiving, and actually today. But that's delayed till January. And our school committee will be meeting and taking information from our public health commissioner, Helen Carlton-Harris, who's been so helpful with us and guiding us through this process. I don't know if you remember, but back in the fall when we continued the season after an outbreak, we tested every athlete to make sure they're safe. So those kind of protocols has really assisted us in making sure our kids and our staff are safe. And we're working with Helen again to make sure that we have the safety piece taken care of when we bring it to school committee for a vote. For families, remember that we have a helpline. It's on our website. Anyone having difficulty with technology or internet connection, please use that helpline. We've talked before about MCAS tests. The commissioner is still waiting to make a decision on MCAS tests. Right now, it looks like they're going to still try to move forward. They haven't given us a determination whether we would be able to have students take the test remotely. The first group is going to be in January. That would be the retest, the 11th graders from last year. We'll give you more information on that. I do think when the new president takes office, the new Secretary of Education is likely to change that scenario, so more information forthcoming on that. Because the MCAS at this point just doesn't make a lot of sense in most people's view. And lastly, we've done a full recovery from our ransomware attack. We're still trying to ascertain if any information got out and deal with that accordingly. But all of our systems are back up and running. Thank you, Mayor.
Thank you, Superintendent Warwick. And again, as he mentions about the flu shots, and Helen does, and Dr. Kerouac, please get your flu shots. I got mine a while ago. It's painless, no problem, and feel fine. And I'm sure the vaccine will operate the same way. And I think Helen has indicated the vaccine is a much higher percentage than the flu shot as far as being able to deal with a situation on that. And as far as schools, Superintendent and I look forward to when we can, in a safe and public health way, get our students and staff and faculty back into the schools. But we're continuing to go above and beyond to make sure that we're ready to roll when it's the appropriate time. With that, he and his department are involved in a multitude of things to get our buildings and parks continue to be shipshape. As the Director of Facilities and Park Superintendent Patrick Sullivan.
Thank you, Mayor. We have 4 out due to COVID today. As the Mayor and the Fire Commission have stated, please stay off of Lake Massasoit. We have done our best to put some orange fencing and keep off signs, but I'm really pleading with parents and guardians, talk to your children, stay off of the area of Lake Massasoit. It's the same regard that we have in the winter when there's thin ice. There's underground springs that feed this entire lake, and these areas are like quicksand. So please talk to your children, and adults, you stay off of it as well. Thank you. The carrier Opti units have started to come into the city. They've been delivered to Kensington and Brightwood schools. We are in the process of setting them up and balancing the electrical systems to operate these units. Police and fire have had the Opti units installed at their stations across the city. We are completing the engineering that will be required at the 4 school facilities where these Opti units will be installed. We have also completed the iWave training, and that has started to be installed across the city as well. We're doing police and fire first for those, and then we'll move into the schools. And then last, the leaf cleanup is going well across the city as far as parks and facilities go. Again, we appreciate your patience, but our goal is to have the city cleaned up by the end of next week. Thank you.
Thanks, man. Thank you, Director Sullivan. Again, I always say that Springfield's in the business of doing business. Director Tim Sheen unfortunately cannot be with us today, but Deputy Director Brian Connors is here. He does a wonderful job. He will give you an update. Deputy Director of Economic Development, Brian Connors.
Thank you, Mayor. Just a couple of quick updates on the Development Division. We are busy working on a quarterly report for HUD for the CARES Act funding to make sure we stay in compliance with that funding and as we prepare for hopefully a new round of stimulus. We're working on a pair of RFPs right now. One is to provide technical assistances to those businesses that have been impacted by COVID for small business planning. And the other is for job training, which we think will be very important going into the new year. This one will be a $97,000 request for proposals for job training in the tech workforce training area. We're working with some accounting firms for future PPP applications. Indicated a gap for small nonprofits and churches in accessing that funding, so we're hopeful to assist those entities. Working with Commissioner Carlton Harris, the division is on neighborhood health centers for those neighborhoods, particularly communities of color, that have been most impacted by the virus. And as the mayor recently highlighted, this past Saturday was Small Business Saturday. We hope residents can look at the entire month as Small Business Month. This year, more than ever, our Springfield businesses are going to need support from the community. So those that are doing holiday shopping, try and think of a Springfield business and a purchase there as an investment in their future so that they'll be there next year when you want to go back and shop there. Thank you.
Thank you, Brian. Thank you, Deputy Director Connors. Thank you, Brian. You received the financial update from CFO TJ Plan I gave you earlier, the HR labor update, the unemployment from Attorney Bill Mahoney. Thank you. And Ed Pakula on the legal aspects. And again, Ed will be facilitating either our third or fourth town hall meeting on continued enhancing of police and community relationships with myself, Commissioner Clapper, Judge Roderick Ireland, and others. And we look forward to announcing that date in the very near future now that Focus Springfield is getting their new location area and their equipment up and running. From there, in turn, there'll be a town hall meeting on the 15th, 6 p.m. on our direction of our schools. So with that, I will open it up, and those town hall meetings are available to any and all. We welcome any and all, whether pro or con, whether police, community relationships, and with the school department. So with that, I will open it up to any questions of cabinet heads or myself. Paul?
I've got a question for
Commissioner Carlton Harris, please. She was in the grandstands.
I'm attempting to follow the governor's guidance. Yes, sir.
We got the windows open too, so lots of ventilation.
We're doing good.
You mentioned, you and the mayor both mentioned clusters that you've identified. Can you talk about how many, and are those all in long-term care facilities?
They are not in long-term care facilities. There are clusters within neighborhood groups. There are clusters within organizations that house individuals in the city of Springfield. So that could be a group home. It could be, so we're talking more about congregate facilities where individuals live, as well as neighborhoods.
And are there any long-term care facilities?
There are.
How many?
There are, well, it depends on your determination of a cluster. And so a cluster in a long-term care facility, right now, we are following 3.
And in the congregate home settings?
2.
2. Thank you.
Okay.
I have a question for Commissioner. Just a quick point. You mentioned that before that the city has training experience in mass vaccine distribution. Is the fact that the likelihood that 3 out of 4 of the leading vaccines are going to require 2 shots add any complication to that, or is that something else that you feel you'll be able to handle easily?
It certainly will take more strategic planning, because in the past, when we've done mass dispensing, it has been one vaccine. And so there will be some planning, and I know that that will happen in conjunction with the State Department of Public Health. But locally, it will take some strategies around how to implement that.
Any other questions or comments? Paul? Yeah?
Question for Superintendent Warwick.
Yes. Superintendent Warwick. Dan, please. He's very happy. Notre Dame's still undefeated in number 2.
I know, they have one more game left, right?
One more and then the national championship will walk all the way.
Oh, okay.
Yeah.
So Notre Dame is
That's a prediction. Yeah.
The state last week announced a release data that showed that there's been a drop in enrollment
Yeah.
pandemic started. What's the status of Springfield Public Schools as far as your enrollment?
It's a serious situation, Paul. We dropped in enrollment just like all the other systems across the state. And like most of the other systems, the heaviest drop was pre-K and K. And for Springfield, it was over 600 total, and 500 plus were pre-K, K. So I think families decided to homeschool or to start later because of what was going on. We've been petitioning the commissioner not to use October 1st as the date to determine enrollment, which would be how we get our funding for next school year, to delay that because we enrolled a lot of students after October 1st. Normally, October 1st is a real sensible date to draw that enrollment, but this year it clearly wasn't. For Springfield, it would be over a $10 million cut in funding if you look at the dollars per student. And that's like every school system in the Commonwealth. This has gone on statewide. So it'll be a serious situation if they don't delay that date that they draw the numbers from. So we're working with the commissioner at the Mass Association of School Superintendents to take a look at that and use a later date on that, or suspend that for a year and hold at last year's count. Because likely all those kids will be back in next year at the beginning of the year. We're going to need to service them, but we won't have the funding to do it. So it's a serious issue.
The town hall set for December 15th, how soon after that will the school committee be meeting and voting on?
Great question, and I should have said that. December 17th school committee meeting, they'll take it up for a vote. But they wanted to get wide input from the public like we did last time. That was a huge success, and really listen to what people have to say. Thank you.
Thanks. Any other questions or comments? Okay, hearing none as I opened, listen, we cannot change the past, but we can choose how we move forward. And that's why it's extremely important that you follow the information that is given here and from the medical professionals. Once again, I want to thank each and every one of you, listening and viewing public, the print public, for your patience, your cooperation, your collaboration as we move to defeat this COVID-19. I know it's been very difficult. It's even heightened more as we're in the holiday season, but you need to adhere to the advice. It was stated we would spike. We are spiking now. I want to thank my cabinet heads all the way down to rank and file who have been tested and true to a number of natural and man-made disasters. We're going to continue to forge ahead, and now the vaccine is right around the corner, and we look forward to getting that out. But in the meantime, we need to stay vigilant, which means you need to wear the face covering and the masks. It's not going to kill you to wear one, as I've said, but it could kill you if you don't. And whether it's from Dr. Fauci on down, to Helen, to Dr. Kerouac, the simple things, washing your hands, socially, physically distancing 6 feet. If you don't feel good, stay home. And for your loved ones, your family members, and your friends, if you have not been around those individuals during this surreal and challenging time, you can't be around them now. I know it's tough, but we're doing this so as we move into a much, much better 2021, you won't have to Zoom anymore. You won't have to give those air hugs anymore. You'll be able to get together. So with that, I wish you a good day and good health, and God bless. Thank you very much.